This video is brought to you by Global Men's Wellness, your 24/7 AI health expert. No copays, waiting rooms, or awkward conversations. Just real answers whenever you need them. Visit globalmenswellness.com to try it free and get your own on-demand concierge-level wellness expert today. Welcome to the Global Men's Wellness. I'm Dr. Judson Brandeis, and I'm so glad you're here. Imagine your body's most sophisticated electrical wiring system, the nervous system, suddenly has a fault. The signals that control some of our most basic private functions are scrambled, leading to a profound loss of control that impacts every minute of every day. This isn't a rare occurrence. It's a reality for millions of people living with conditions like spinal cord injury, multiple sclerosis, Parkinson's disease, or who have survived a stroke. The consequences go far beyond inconvenience. In the past, this breakdown in communication between the brain and the bladder was a leading cause of kidney failure and early death. Today, we have a revolutionary new framework for managing this condition, one that is not only saving lives, but restoring dignity and quality of life. We are going to explore this modern, intelligent approach to care, which shows us that the goal is not just to manage a problem, but to proactively preserve health for a lifetime. The condition we're talking about is called neurogenic lower urinary tract dysfunction, or NLUTD. For years, it was simply called neurogenic bladder, but we now know the problem isn't confined to just the bladder. It's a complete communication breakdown between the nerves and the entire lower urinary system, including the bladder and its sphincters. Depending on where the neurologic damage occurs, in the brain, the spinal cord, or the peripheral nerves, patients can experience a wide range of issues. Some may suffer from a failure to store urine, leading to urinary incontinence, while others face a failure to empty, causing urinary retention. Many patients frustratingly experience a mix of both. NLUTD is not a single disease, but a consequence of an underlying neurologic condition, and its management is one of the most complex and vital challenges in urology. So, how does modern urology handle this complex issue? The breakthrough isn't a single new drug or device, but a new philosophy of care, outlined in the 2021 guidelines from the American Urological Association and SUFU. The approach is built on a foundation of proactive risk stratification. The primary goal is no longer just to treat symptoms like leakage, it is to protect the kidneys. High pressure inside the bladder can back up into the kidneys and cause permanent damage. The first step is to determine a patient's level of risk. Through a detailed history, a physical exam, and a few simple tests like a urinalysis and a post-void residual measurement, we categorize patients as low risk or as unknown risk, requiring more investigation. This allows us to create a personalized roadmap for evaluation and long-term surveillance that is tailored to each individual. This risk-based approach is a major evolution in care. While doctors have been treating NLUTD for a long time, these 2021 guidelines represent a shift towards a more intelligent, evidence-based, and patient-centered model. The guideline itself was built on an exhaustive review of scientific literature, screening over 20,000 studies to build its recommendations. It's proven that not all patients need the same intensive workup. For instance, the guidelines give a strong, grade A recommendation for the use of onabotulinum toxin, or Botox, in patients with spinal cord injury or multiple sclerosis whose bladder problems don't respond to oral medications. It also strongly recommends clean intermittent catheterization over chronic indwelling catheters to reduce long-term complications. This is a proven framework for optimizing patient safety and quality of life. Given its importance, why isn't this approach more widely known? Part of the challenge is the sheer complexity of NLUTD. Management depends on so many factors beyond the bladder itself, including a patient's hand function, cognitive ability, mobility, and social support system. The focus for patients and many doctors is often on the primary neurological condition, like learning to walk again after a stroke or managing mobility in Parkinson's disease. And the bladder can be treated as an afterthought. However, for patients, bladder and bowel function are paramount. In one study, patients with spinal cord injuries reported that they would value the restoration of bladder function as much as regaining the ability to walk. This highlights a disconnect between clinical priorities and what truly matters to a patient's daily quality of life. A patient's journey with NLUTD is now highly personalized based on their risk level. For a low-risk patient, say someone who has had a stroke but has good bladder emptying, the initial evaluation may be all that is needed. with education on what symptoms to watch for in the future. For a moderate risk patient, surveillance might involve an annual clinic visit, a check of kidney function, and a kidney ultrasound every 1 to 2 years to screen for stones or damage. For a high-risk patient, someone with urodynamic tests showing dangerously high bladder pressures, surveillance is more intensive, with annual imaging and more frequent check-ins. The experience is designed to be proactive, catching potential problems early while minimizing unnecessary testing for those at lower risk. This is the heart of personalized urologic care. We don't treat neurogenic bladder. We treat an individual with a unique neurologic condition and a unique set of circumstances. A patient with Parkinson's disease typically has a suprapontine lesion, which usually results in detrusor overactivity but safe low bladder pressures, placing them in the low-risk category. In contrast, a patient with a spinal cord injury is automatically considered unknown risk until they undergo further testing, like urodynamics, to see if they have high-pressure storage or detrusor sphincter dyssynergia, a dangerous lack of coordination that can harm the kidneys. We also tailor the treatment to the person. Can they perform self-catheterization? Do they have the cognitive ability to manage a complex medication schedule? Their care plan is built around their life. This personalized, risk-stratified model is incredibly effective. It achieves the two most important goals: preserving long-term kidney function and dramatically improving quality of life. Treatments range from non-surgical options like pelvic floor muscle training and oral medications to advanced therapies. For patients refractory to medications, onabotulinum toxin A injections can reduce incontinence and improve bladder storage parameters. For others, reconstructive surgery like an augmentation cystoplasty can create a safe, low-pressure reservoir. And importantly, the guidelines strongly prioritize bladder management that gives patients the most independence and lowest risk of complications, like clean intermittent catheterization over a permanent indwelling tube. The future of urology for NLUTD patients is focused on even greater personalization and less invasive options. Researchers are exploring better neuromodulation strategies, including implantable tibial nerve stimulators and MRI conditional sacral nerve stimulators that would allow MS patients to receive this therapy without forgoing necessary imaging. There is also incredible promise in regenerative medicine. Imagine being able to use tissue engineering to create a scaffold for bladder augmentation, avoiding the need to use a piece of bowel, which can come with metabolic complications. The ultimate goal, of course, is to treat the underlying neurologic condition itself, and therapies like stem cells are being investigated to see if they can restore not only motor function, but bladder function as well. I do this work because it represents a fundamental shift in how we care for people with complex, life-altering conditions. It's a move away from simply reacting to problems and toward proactively preserving a person's health and dignity. By understanding a patient's individual risk, we can give them the exact level of care they need, no more and no less. We can provide them with tools and strategies that offer them the most control over their own bodies and their lives. The better way isn't about a single magic bullet. It's about an intelligent, compassionate, and personalized partnership between the patient and their clinical team, focused on ensuring a long, healthy, and high-quality life. Thank you for listening. Take control of your health anytime, anywhere. Visit globalmenswellness.com and start your free trial today. Get expert-level answers in seconds, not weeks, without the cost, the wait, or the awkward conversations. Real support on your terms. Visit globalmenswellness.com now.